Okay, so today we'll be walking through the artificial airway care and cuff care. So first we're going to start off by washing your hands. And after you've washed your hands, you're going to be placing on your gloves. All right, so pretend I'm placing my gloves on. So with the artificial airway care, you're going to be doing the Yonker suction and the closed suction. The Yonker suction is going to be done every 4 hours at the vent check, and the closed suction is going to be done whenever the patient needs it. So they're going to be hooked up to the ventilator since it is closed suction. So you would hear you will feel vibrations in the patient's ET tube. That will let you know that the patient needs to be suctioned. And also, if you listen to the patient's breath sounds, you will hear crackles or rhonchi in the patient's lungs. So that will tell you that the patient needs to be suctioned. So with the Yonker suction, you will hook it up to the suction catheter. Make sure it's at the right parameters. So for the adult patient, we're going to be doing 100 to 120, or some hospitals and therapists do 150 millimeters of mercury. So we hooked it up. We make sure the parameters are correct. Turn the suction on. You're going to make sure to move the patient's ET tube to one side of the mouth. This is being done every 4 hours as well, because you were trying to prevent the patient from developing any mouth sores or blisters. So so move the patient's ET tube to one side of the mouth, right or left, and then suction just around the mouth. Move it to the other side, suction the other side. And that is the Yonker suction. So next you would do the closed suction. This is a sterile procedure since the patient is intubated. So you will take the Yonker off, and you would change the parameters on the suction thing to vacuum. You will hook the closed suction up, pull the suction catheter inside the patient's ET tube. So pull the tube, make sure the tube is all the way in, and then you would unlock the button, press down on the button, and just keep pressing it to suction all the secretions out of the patient's lungs. And also to make sure that the suction catheter is all the way out of the ET tube so the patient does not aspirate. Okay, and for cuff care, so what you do is you hook the patient's balloon that's connected to the ET tube to the cuff manometer. So you're checking the pressure, the cuff pressure on this. So after you hook the balloon up to the cuff manometer, you're going to press down or squeeze the manometer to inflate the cuff. Press the red button on the back of the manometer to let the air out, and you're checking to see if the line is in the green area. This will let you know that the cuff is at the correct, is inflated enough and the pressures are correct. All right, and that's it.